Now we are going to bring you a quick take by the numbers where we give you the data that tells the story. This morning's number is 8. Black women in New York City are 8 times more likely than their white peers to die from a pregnancy-related cause, a maternal mortality rate even higher than startling nationwide statistics. The U.S. has some of the highest maternal mortality rates among high-income countries. Black and Indigenous women, however, are 3 times more likely than white women to die from pregnancy-related causes. Black women are also more likely to lose their babies. When it comes to health equity, maternal mortality is just one of the many issues, and we are making it our quick take focus of the day, and Sonali Basak is here now. Sonali, this has become a topic that a lot of people from the federal government are talking about. Kamala Harris, Vice President, was just talking about it last week, but still a long way to go to protecting would-be mothers.
Yeah, protecting would-be mothers, and as you said, a lot of issues at play when it comes to healthcare, including what we saw at the beginning of the COVID crisis and getting vaccines to underrepresented populations. And how do you fix that? It's a matter of resources and a matter of awareness. Here now to talk about this more is New York City public advocate Jumaane Williams. Jumaane, thank you so much for being here. You are working on plans to improve maternal health. What is the first step?
Well, thank you very much for not only talking about this issue, but continuing to bring it up. That's the first step, is actually making sure people are aware of how bad those statistics are. They're terrible, and they outpace, in New York City, even outpace the national statistics. And so we want to continue to beat the drum on that. We have also put forth a package of legislation in the city council. Unfortunately, it hasn't been voted out yet. We're hoping that happens in the next term. So we can start addressing this from a real issue and from a real point of power. And I want to make it clear that this data has nothing to do with the socioeconomic status of the woman. The main difference is the skin color, which is unfortunate. And when we started working on this a couple of years ago, I had no idea that myself and my wife would be affected by this, and we've begun sharing our story as well.
Jumaane, I'm wondering if you could speak to your plan. How do you expect to move forward here as you look to improve these dire statistics?
Well, one, we do have a resolution to support the city council, to support the omnibus bill that's happening in the federal government. That's really important in terms of resources. We also have a couple of bills to help do what we can in the city. The first is a maternal bill of rights, so that people understand what their rights are. There are many patients who are intimidated. They think they're speaking to the experts and not sure what to ask for. We have another bill that is hoping to bring mothers back into the workforce. Many times they are so far back and not given the tools and resources they need. This bill would force people to have onboarding and jobs when people come back to the jobs, so they can come back and not lose a step, because we've seen regression in terms of pay and advancement when people give birth and come back to work. But more importantly, we have to keep talking about this and acknowledging this. And imagine they're doing it on a federal level, because it's happening all over the country. And New York City in particular is worse than the entire country. So there's a lot of things that we should be doing locally here in the city and the state to address this. And we're doing what we can as a public advocate. And we're asking all leaders to talk about this, because the percentages are ridiculous. If we saw these numbers in a different country, we might talk about bringing this up in the UN, but it's here in the United States, and for too long it's been allowed to happen.
That's New York City public advocate Jumaane Williams, as we said, running for governor of New York as well. Thank you so much for your time.
Hey, thanks for watching Bloomberg Quick Take Now. Subscribe to our channel to see the biggest stories the moment they happen from around the world. And tune in to our 24/7 live stream for global news coverage, documentaries, interviews, deep dives, and shows on the stories that you care most about.